Thanks for the introduction, Kristen. Let me accept my recording. Perfect. So I've got just a couple of housekeeping items for those of you who are new to our webinar series. Just as Kristen mentioned, all callers are in listen-only mode, and but you can still communicate directly with Kristen. If the chat function is new to you, I have a little bit of instructions on how you can access that chat box. You're going to hover over the Zoom toolbar at the top of the screen. You'll see a chat box icon there. When you click on that icon, the chat box should appear. Kristen will receive your messages in real time, and she'll respond to your message in the order that she receives them. So if there is any delay in her response, she'll get to your message as soon as she can. If you are attending this webinar in a conference room or you used a single webinar access from your team, please chat the number of attendees to Kristen so that we can get a more accurate number on attendance. So next is our disclaimer. The information provided in this presentation is intended solely for the general information of the audience. It is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. So welcome everyone to the July Wellness webinar called Acupressure, From Restlessness to Peace of Mind. This webinar is brought to you by HealthNet Wellness. So at the end of the presentation, I hope to provide some education on the acupressure modality itself, ways it can be self-applied, and common uses. The use of complementary and alternative medicine is on the rise. Acupressure and acupuncture is a form of complementary medicine. It actually shares the list with relaxation techniques or meditation, yoga, and massage. Almost 1 in 5 adult Americans suffer from some type of anxiety disorder. So about 37% of individuals will actually seek treatment for their anxiety. But approximately 63% of people with this disorder continue to struggle alone. And there's been scientific research that found that acupressure and acupuncture can have positive effects on depression and anxiety. So what is acupressure? Well, acupressure has been practiced as a healing art for at least 5,000 years. It's the third most popular method for treating pain and illness in the world. And acupressure is essentially a method of sending a signal to the body to turn on its own self-healing process or regulatory mechanisms, if you will. And the goal of acupressure is to encourage the movement of qi or life energy through the body. And the belief is any imbalance leads to illness. So when there's illness, there are blockages. Acupressure is believed to clear these blockages and with it increase circulation and bring improved flow or qi energy to the muscles and to the organs. Acupressure is also believed to help provide relief with different ailments. What acupressure is not is a substitute for medical care. So let me give you an example. 10 years ago, I started experiencing vertigo. It would come every now and then, about 4 to 5 times a year, and it would last a few days, but they were the gnarliest 3 days. I was introduced to acupressure to help with the symptoms, but I still saw my doctor and care team to make sure there was no underlying health issues that was producing the symptoms. So now I continue to use acupressure to help with symptoms from my migraine-induced vertigo, and hopefully the information in this presentation will help you determine if acupressure is for you. Acupressure has several advantages in that it can be self-administered in many different situations, regardless of time and place. Acupressure, not to be confused by acupuncture, are sort of the same but different. So acupressure uses the finger, palm, or the tool, so basically your hand, and it's applied with pressure on the skin. Variations can include combining with massage and using massage oil. And acupuncture uses thin needles, so it is applied via puncture or insertion into the skin. And there are variations which include the application of heat, some pressure, and laser light. So for the sake of self-application, I will be focusing on acupressure. So just as blood vessels carry blood throughout the body, acupressure uses meridians. Meridians are distinct channels that connect acupressure points to each other, and it helps with circulating the energy or the chi throughout the body. The acupressure points are located underneath the major muscle groups or near bone structures. So they're identified by referring to anatomical landmarks. And when it's stimulated through acupressure, either by one or several points, a signal is sent to other parts of the body. So, you can apply acupressure, like say on the shoulder, but then maybe feel sensation somewhere else in the body. Although acupressure is generally very safe and gentle, there are some precautions. You want to avoid performing self-acupressure on abdominal points if you don't have professional training. If you're pregnant, you want to avoid acupressure unless it's performed by a licensed practitioner, because there are some acupressure points that can cause premature labor. You also want to avoid performing acupressure on areas where the skin is broken, has been recently injured, or where surgery has occurred. So including areas that have varicose veins or any cancerous tumors. Acupressure, as I mentioned earlier, can be applied with the hand or the elbow, or using tools. So with your hand, you can use your fingers, your palms, and your knuckles. And the benefit is it provides accurate tactile feedback. You have better control, and with the fingertips, you can address a specific area. Tools prevent hand fatigue. So, if you tend to have like joint pain, or the muscles in your hands are a little weak, tools can be very helpful. It also relieves pressure on your fingers, especially on your joints. And tools can cover broad areas. So some example of tools can include knobbles, pointers, the foam roll, which a lot of you may be familiar with, and specialized ball, which is shown here on this slide. So next, I'll go over some common uses for self-acupressure. There are step-by-step instructions for finding the acupressure point on the slide. And if you'd like to practice these points on your own, as Kristen mentioned, she'll be sending out a recording of this presentation. So there's been several studies about the effectiveness of acupressure with positive qualitative and quantitative data. In 2012, published in the Journal of Peri-Anesthesia, there were 70 subjects who were experiencing anxiety before having abdominal surgery, and they received acupressure. Half of them were provided acupressure on true acupressure points. And then the other half, they served as the control group. They received acupressure on fake points. Both groups were found to report a reduction in pre-surgical anxiety levels, but there was a significant difference in vital sign means for the subjects that received acupressure on true acupressure points. A study in 2018 found similar results. So researchers found that acupressure applied to the yin tong point for 5 minutes was effective at relieving anxiety for expecting mothers about to undergo cesarean section. So next I'll talk about some different situations when self-acupressure can be applied. Anxiety disorders are different from ordinary anxiety. Every person experiences anxiety at some point in their life, for example, during an examination or an interview, and this typically lasts for a limited period of time. People with anxiety disorders, excuse me, frequently have intense, excessive, persistent fear about everyday situations. And often anxiety disorders involve repeated episodes of intense anxiety and fear or terror that comes suddenly and it reaches a peak within minutes. People may avoid going about their daily lives in order to prevent this level of anxiety that may cause a lot of uncomfortable physical sensations. So for example, panic attacks, post-traumatic stress disorder, obsessions and compulsions, uneasiness, nausea, shortness of breath, and sleep-related problems. So there's acupressure for anxiety disorders. The acupoint called the Great Surge, or L3, is located on the top of the foot. And so performing acupressure on this point can help with panic attacks. So to find this point, you're going to place your finger between the tendons of the big toe and the second toe, and about an inch up from the base of the toes. You're going to press deeply into this area for about 1 to 2 minutes while breathing deeply. You can also use your big toe or your heel from the opposite foot for a more discreet application. So for example, if you find yourself having a panic attack during an examination and you don't necessarily want to reach under the table to touch your foot, you can try using the tip of your shoe or big toe or your heel to press on that generalized area. So this is the same acupoint that was mentioned earlier in the cesarean study. The acupoint yin tang is located at the midpoint between your eyebrows, also called the third eye. And doing acupressure on this point can help relieve stress and anxiety. So to find this point, you're going to place your thumb or your forefinger between your eyebrows. You're going to apply pressure in a circular motion on the acupoint for about 5 to 10 minutes. The acupressure should be gentle and shouldn't cause discomfort. Acupressure helps calm the middle of the brain, which is an area called the hypothalamus. And this is often on overdrive in people who are depressed. And when this area is calmed, the stress system produces less cortisol, a hormone that in chronically high levels will contribute to depression symptoms. So we have an acupressure point for that. And this acupressure point can help with grief and depression. So this acupoint is called letting go, or L1. It's located on the upper outer portion of the chest, about 3 finger widths below the collarbone. And holding on to these acupoints on both sides can facilitate letting go of uneasy emotions. So this particular acupoint has various steps. So I'll go over this for clarity, and then you can definitely go try this on your own. So when you've located the acupoint shown here on the picture, you're going to apply deep but comfortable pressure. You're going to look forward, inhale slowly and deeply. Then you're going to gradually release your fingers off the acupoint while lifting your chest and tilting your head back. So envision lifting your heart towards the clouds. You're going to hold your breath for a few seconds. When you exhale, your chest and head returns to starting position and your fingertips return to the acupoints. And this is something that you would repeat about 4 to 5 times. Can acupressure help with insomnia? Well, acupressure can improve sleep by promoting relaxation and rest. There's been many studies using acupressure to treat insomnia, and they found results that are similar to medication, but without the harmful side effects, such as tolerance, addiction, neurological toxicity, and excessive sedation. So if your insomnia is not associated with any other underlying medical condition, because you've already consulted with your doctor, acupressure can help induce sleep. So to locate the spirit gate acupoint, you're going to find a crease on your outer wrist. This is the area just below your pinky finger. You're going to feel for a small hollow space in this area, and you're going to hold the point for about 2 to 3 minutes. And you can do this on both sides. Can acupressure help with pain? Pain, while often considered physical, can actually contribute to anxiety and restlessness. So when the acupoints for pain are stimulated, parts of the nervous system are also stimulated to relieve pain. And this can include headaches, fibromyalgia, musculoskeletal pain, post-surgery recovery, sciatica, and TMJ, or temporal mandibular joint problems. All right, so acupressure points for pain. There are 2 common acupoints that will help with not only pain, but discomfort and body aches. So the first acupoint is called the hegu, which is located in the soft, fleshy area between the bones of the thumb and the index finger. Do not use this acupoint if you're pregnant, because this acupoint can cause premature labor. This acupoint is handy when you're getting like uncomfortable procedures done. So for example, a friend of mine did self-acupressure on this point while they were getting their braces tightened at the dental office. The second acupoint is called the zongzi. It's used for temporal headaches, shoulder and neck tension, as well as upper back pain. And this acupoint is located in the groove between the knuckles of the pinky and the ring finger. All right, so I just went over quite a lot of common acupressure points that you can reference on your own. I picked 2 for us to do for practice. So let's get started. But first, let me talk about how to apply self-acupressure. So you want to get into a position that is comfortable so you can relax. You want to breathe deeply, gently, and slowly throughout the treatment. And after you've located the acupressure point, you're going to use the finger pad or your palm to self-massage and stimulate each point. You're going to start with light pressure and add deep pressure slowly. Focus on the sensation. You can close your eyes if you need to. You're going to apply pressure on the point for about 40 seconds. But when you do this on your own, you can go up to three minutes. And you can repeat up to 3 times for each point. You can either press and hold, or you can use a circular motion. And there may be some slight discomfort and tension at the point, but it should never be painful. Adjust the amount of pressure accordingly if you feel pain. So now I want to give you a minute to relax in a comfortable position and remind you to avoid holding your breath. You want to breathe slowly throughout the entire treatment. So let's practice acupressure for upper body tension. This is great to do when you're feeling tension on your neck, your shoulders, and your upper back. So first, locate the acupoint using the finger pad to self-massage and stimulate the Zongzi acupoint, which is located in the groove formed by the tendons of the pinky finger and the ring finger just behind the knuckles. Please use the first image for reference. I like to use my index finger, but you can use any finger that you feel comfortable with. On the second image, the thumb is displayed on the acupressure point, but go with what feels more comfortable for your hand. So once you've found the point, you're going to stay right there. You want to start with light pressure. So ask yourself, how does this point feel? There may be slight discomfort and tension at the point, but again, it should not be painful. If there is pain, you want to adjust the amount of pressure accordingly. If there is no pain, then try adding deeper pressure slowly. Now that you've located the point, go ahead and close your eyes and focus on the sensation between the acupressure point and your finger pad. You can either press and hold or use a circular motion. Continue to breathe in slowly and deeply through your nose and exhale slowly and steadily as if you were blowing through a straw. Go ahead and release your touch on the acupressure point. So next, let's practice an acupressure point for fatigue, headaches, and migraines. So first, you're going to start with interlocking your hands with your palms cupping the back of your head. You're going to use your thumbs to locate the acupressure point called Feng Qi, which is located where the neck muscles attach to the base of the skull. So once you've found the spot, you're going to start with light pressure and add deep pressure slowly. And once again, there may be slight discomfort and tension at these points, but it should not be painful. And you might even actually experience discomfort and tension on more side than the other, which is totally normal. Once you've located the point and your fingers are in position, go ahead and close your eyes. Focus on the sensation between the acupressure points and your finger pad. Usually when my eyes are closed, I like to try to visualize the muscle and kind of picture it melting or relaxing. You can either press and hold or use a circular motion with your thumbs. Again, remember to breathe slowly and deeply. There are many extensive studies conducted with this particular acupressure point in scientific literature. In neuroimaging studies, stimulation of this point has been shown to affect systems in the brain that may affect the body's response to stress. Go ahead now and slowly release your touch on the acupressure point. Some other common therapeutic methods used to stimulate acupoints include laser acupuncture, cupping, which many of us have known from pro athletes in the Olympics, and moxibustion, shown here, being lit with an incense stick. Acupressure can be combined with deep tissue massage or breathing techniques, acu-yoga, and many other techniques. I'll discuss acupressure combined with breathing techniques, massage, acu-yoga, and tai chi, since these methods can also be done as part of self-care without additional equipment. So first, let's talk about acupressure with breathing techniques. We've kind of sampled it when we were practicing our acupressure. So breathing detoxifies and releases toxins. Your body releases 70% of its toxins through breathing. Breathing releases tension. Your body constricts when it's angry, scared, or stressed. When you breathe deeply, your body gets the oxygen it needs and tension is reduced. Breathing brings clarity. Paying attention to your breath relaxes your body and your mind. Breathing also relieves pain. Breathing helps clear uneasy feelings to help ease pain. Since acupressure on its own does not involve massage strokes or the use of creams and oils, it actually falls under the category of body work. Acupressure combined with massage strokes can be done to release tension and increase circulation in the body. So for example, if you arrive to a massage appointment and you have difficulty relaxing, you just maybe have too much things on your mind, something happened on your way to getting to your massage appointment, you can perform self-acupressure prior to your appointment to help you relax. Or your massage therapist, if they're trained in acupressure, can begin the session with addressing the acupoints for relaxing and calming the mind to allow you to be more present in receiving massage. And then during the massage session, your trained massage therapist can use acupressure to help release muscle tension if you prefer to not receive deep tissue massage, or the area you want addressed is not ideal for deep tissue massage. So, for example, acupressure can help prime the area into relaxation rather than the massage therapist kind of digging into the muscle, muscling through it to force it to relax, which oftentimes does the opposite, right? When we experience uncomfortable massage, we tend to tense up, so it's counterproductive. This would be an opportunity for acupressure. So after the massage session, acupressure can help ground you, which is important to end a massage session. Grounding ourselves helps us to be more relaxed. It releases anxiety and uneasy feelings, and it brings you back to the present. Acu-yoga is a combination of acupressure techniques and yoga exercises that are also known as yoga asanas. Yoga poses naturally stimulate specific meridians. So how is this possible? Well, the meridians are stimulated from the stretches that we do and the contact that's made by the body and the floor. And this can benefit healing, and individuals can do this at home. However, if you have a history of joint pain, low back issues, or you're in your late-term pregnancy, please consult with your physician before performing acu-yoga. So on the next slide, I'll go over a few common acu-yoga poses that you can do on your own. No equipment is needed. However, a yoga mat is optional, and you can do these poses to start off your day or to end your day. So one of the most recognized yoga poses in the West is the downward facing dog, also known as down dog. It's a standing pose that builds strength while stretching the whole body. And it's named after the way dogs naturally stretch their entire body. So while stretching, this pose also stimulates the acupressure points that aid in allergies, cold and flu viruses, anxiety, and insomnia. So remember to always work within your own range of limits and abilities when trying these acu-yoga poses. The Warrior Two pose targets healthy lymph flow, which awakens the heart and the lung meridians to help maintain fluid circulation. It also enhances immune health, sleep problems, depression, and stress. The child's pose position stretches the lungs and the upper back while draining out the sinuses. And this pose elongates the meridians within the torso, which is great for tendonitis, tennis elbow, and carpal tunnel. The pull across the shoulder blades while you're stretching out the back of the neck can help relieve tension from stress or cold and flu viruses. And so you've noticed on the past 3 slides, if you choose to try these yoga poses on your own, there are step-by-step instructions on how to get into the position. So Tai Chi movement of internal energy. One of the fundamental practices based on moving energy through the meridian lines of the body is called Tai Chi or Qigong. With Qigong, practices like Dragon and Tiger medical Qigong, you learn to actually feel the Qi or energy move through your body. Tai Chi has evolved into a graceful form of exercise that's now used for stress reduction and a variety of other health conditions. Tai Chi is often described as meditation in motion. It involves a series of movements performed in a slow, focused manner, and each posture flows into the next without pause, so that you're in constant motion, accompanied by deep breathing. I studied Tai Chi for a couple of years, and it's amazing how warm your body feels moving the speed of a sloth. And that temperature change comes from the transfer of energy throughout the body, the Qi energy. And it teaches you to slow down because the movements are so slow. Your mind is focused on movement and breath. So if a class is offered nearby, I encourage you to check it out. Check with your health provider or community for some classes. I went over many acupoints today. I want to summarize 4 key points on acupressure before I move on. Acupressure can be used to restore vitality, address pain, headaches, insomnia, and uneasy emotions. The meridians are pathways that connect the acupoints to each other, as well as to the internal organs. If you're pregnant, avoid certain acupoints because it can lead to premature labor. And combined with breathing, it changes the chemistry in our body by releasing toxins and tension. If you found acupressure to be interesting and something you want to practice on yourself, pointfinder.org helps identify acupoints for specific parts of the body that you can select from a list. And if you have a smartphone or a tablet, it's like having an acupoint dictionary. So beyond self-acupressure, there's a couple of things that I want to call out that's beyond self-acupressure, but I find it relevant to mention. The growing opioid epidemic proves that powerful pain medications can often do more harm than good, and people struggling with this type of addiction often report their addiction started while taking prescription opioids for pain relief. So some doctors are hesitant more than ever to prescribe prescription pain medication. And due to the studies providing or even proving its benefit, some doctors are looking at acupuncture, which again is the acupressure version that involves needles, as an alternative treatment option. And some people think it helps highlight areas in the brain that decrease the sense of pain. There are lots of different hypotheses about why it works, but it has been proven to help. In fact, the American College of Physicians now backs acupuncture for treating back pain. Mental health conditions related to COVID-19. So there are elevated levels of adverse mental health conditions, substance use, and suicidal ideation that were reported by adults in the United States in June 2020. So the prevalence of symptoms of anxiety disorder increased approximately 3 times those reported in the second quarter of 2019. So we're looking at 25% versus 8%. The prevalence of depressive disorder was approximately 4 times greater than reported in the second quarter of 2019. So we're looking at 24% versus 6%. So while there's still a stigma around mental health issues, the traumatic pandemic we're beginning to emerge from has shined a light on the importance of mental and emotional health. There's more programs that focus on mental health that are being offered from health providers, employers, and communities, including meditation, resilience seminars, and acupressure. The next slides will cover some programs that are available to HealthNet members. But if you're not a HealthNet member, please check with your health plan or health provider for similar programs. The goal is to help people access treatment and support. So I'd like to direct your attention on an online tool and app that can also help you in managing stress, anxiety, pain, and depression. The program My Strength is available to HealthNet members. HealthNet members can self-enroll online through either their member portal or through mystrength.com using an access code. You can also receive referral by your case management. Members can find wellness programs and other resources when you log into your HealthNet account. Tackling new health goals can be challenging, but you don't have to face it alone. A health coach can help you prioritize your goals, strategize a plan, support you through your journey, and help you tackle those bumps on the road. So if you're experiencing pain and restlessness beyond what self-acupressure can do to help, or you have other concerns, the nurse advice line can answer questions anytime, day or night. HealthNet members can also receive discounts on complementary care like acupuncture services and massage therapy, along with other services and lifestyle improvement products. Next month, HealthNet will be presenting Keeping Your Brain Healthy. Staying fit doesn't mean to just exercise and eat healthy foods. As we age, it's important to keep active with things that keep both our bodies and our brains fit and healthy. Every brain changes with age, and mental function changes along with it. The memory process is very important and contributes to brain health. So in this webinar, you'll learn about useful ways to keep your brain healthy and engaged, how to boost your brain power, and explore Alzheimer's disease. It'll be on Wednesday, August 18th at the same time, 12 to 12:45 Pacific Standard Time. That's my time, everyone. Thank you so much for attending the webinar today. I hope you enjoyed it and found it interesting and insightful. We hope you will join us all next time. And if you'd like to receive a recording of today's webinar, Kristen will send out the recording to everyone that's registered for this webinar within a couple of days. I think she may have said earlier that she'll send it out by tomorrow. So enjoy the rest of your afternoon, everybody. Bye now.